Warm welcome from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation. I'm here with Charlotte Mbou, who is in Ebolova, Cameroon. We welcome you to this special session following a very exciting event. How are you doing, Charlotte?
Hi, Rida. Hi, everyone. I'm doing great. Thank you. And it's a pleasure to welcome you to today's workshop.
Wonderful. And so we are following up on an event that was held on the 28th of July, and you'll be hearing and meeting Maïssa Jalad, who's a researcher and citizen science coordinator at PROCOL Lebanon. She's of course going to introduce herself, but she'll be leading us through a quick presentation, a quick review, an overview of citizen science, and then opening up the discussion on what citizen science might mean for health professionals who are concerned about these effects of climate on health. So she'll be introducing herself in a few minutes, and we'll be getting started. Let me get myself out of the way in just 1 minute and 24 seconds. It does seem like there's been some kind of glitch with the invitation, but we're happy with those of you who have found your way to the session, and look forward to our dialogue and learning together. So we are now 1 minute away and counting down. If you're just joining us now, we're counting down to a follow-up to the session on the 28th of July. 4,700 health professionals who had registered for this special event. And we're coming together again today, this time with a follow-up workshop that is now just a few seconds away. You can count down with me, 27 seconds remaining until we get started. We're looking at your messages on the cross social media. So whether you're watching on YouTube, LinkedIn, Twitter, wherever you are, we want to say hello, for example, to Hadiza Umar, who says, glad to be here and eager to learn. Wonderful. And thank you, Hadiza. All right. So I'm Rida Sadki from the Geneva Learning Foundation here with Charlotte Mbou. We'll be facilitating, but actually you'll be meeting and hearing from Maïssa Jalad, who's a researcher and citizen science coordinator at PROCOL Lebanon. We're going to kick off by connecting with Argentina and Maria Fernando Manzan. I don't know how long ago you woke up, but you're going to tell us really want to know what you felt. What was the emotion in Friday's event that I believe you did attend last Friday, climate and health, and a lot of concern expressed. What was your experience? What did you feel, Maria?
Well, hello, everybody. Good morning from a very sunny and hot day here in Argentina. It's actually 10 a.m., so we're good. Well, today is a good example of what climate is suffering, because we're in the middle of the winter and it's 28 degrees outside, 28 degrees Celsius. So this is just one way to show how urgent is the need to protect our planet and to everybody to work with it. So I did participate in the other event. It was incredibly interesting. Here, our experience is my experience personally in my area. It's a subtropical area, and we've had a very big increase in dengue, in an epidemic with dengue fever, and that is, of course, incredibly related with the climate change. And we've had last year very, very bad wildfires, and that has affected the natural reserves that we had, and we're still trying to recover from that. So that obviously has affected, everything related to health. I'm a pediatrician, so I work in a health center, and I've seen children with everything that has to do with the dengue epidemic, and that has been a huge challenge right now. So it's an urgent need for all of us to be focusing on this too.
So, Maria, we know you for your immunization work in your health clinic, and we know you are a leader in the movement for Immunization Agenda 2030. And we know also that you are very busy. How can you possibly find the time to start thinking about the effects of climate and health on top of your daily work and on top of the work that you're doing, connecting with thousands of other members of the movement for immunization? How does this fit in? Why it sounds like you're quite concerned.
Oh my God. I think I just think of it like, I'm not going to change the planet today from tomorrow to tomorrow, but the little things, it's, first acknowledging it. I think that's the first step. It's like, yeah, I am concerned and I have seen the changes and I have seen how it has affected my population. So in the daily work, it's like, the little things and how we first start seeing the changes and what we can do day by day, baby steps. I'm not focusing on the big things because that would make it just, very impossible. But I think it's all of us, one little grain of sand. That's what's going to make the difference. So I love when we do it, in this global idea, everybody getting together, because the little ideas, everything that they've done in Ghana, or what they're doing in Nigeria, or how they're coping with it in Cambodia, that's what will bring us all together. Even here, very far away in Corrientes, Argentina, that's what's going to bring us better. It won't be tomorrow, it won't be next week, but it will happen if we're all together in these kind of movements. So, of course, immunizations, yeah, but this too. So
Thank you, Maria.
I think it starts with acknowledging it.
All right, let's go to Faraz Chaudhry Sharif. Faraz, would love to hear from you. I hope you're able to unmute your microphone. Otherwise, we'll go to Monica Agu. And I'm trying to reach Irene Tukashaba, but it seems like she's not yet connecting. Faraz, warm welcome to you. In one sentence, tell us who you are, what you do, where you work, and then tell us what was the emotion? What did you feel in last Friday's climate and health event?
Hi, can you hear me?
Yes, can you speak very close to your microphone and very loud?
I'm not sure if you can hear me clearly, as I'm traveling right now and there is some distortion in the voice.
All right, we can hear you.
I'm a WHO as consultant in immunization.
Yes.
As a disease survivor in Pakistan.
In Pakistan, okay. And what did you, if you attended last Friday, what did you feel? Obviously, Pakistan has been confronted with floods and other consequences that are said to be related to climate change. What's your perspective?
The perspective is very clear. The things in Pakistan are happening. The floods, the dengue. Every year is hotter than the last year, and not just as a figure of speech, but we are actually having the worst years in terms of temperature in Pakistan every summer, and then floods, then drought in some areas, on climate, on agriculture, in different disease, in health concerns. Then there is smog. So climate is devastating. The change in climate is devastating here, and it's applicable in every wake of life. Whether it's health, whether it's agriculture, whether it's poverty, the climate and the change, this abrupt and devastating change in climate is happening everywhere, and it's affecting every person. Every single life in Pakistan is being affected by this.
Thank you, Faraz Chaudhry Sharif. We'll hear one last... Oops, I accidentally muted you, Monica Agu. Let me ask you to unmute again. In a second, after we hear from Monica, we'll be kicking off the workshop, hearing and meeting Maisa Jalad, the researcher and citizen science coordinator, who's going to help us explore citizen science for health professionals. Monica, could you briefly introduce yourself and tell us what you felt last Friday at the global event that brought together 4,700 health professionals from all over the world to share their concern over the connection between climate and health?
Thank you. My name is Monica Agu. I'm a community pharmacist based in Lagos, Nigeria, in a district called Ajah, a a district that is at the same level as the sea, and with a lot of flood and a lot of malaria because of pools of water here and there, and a lot of skin infections. From the last session we had, I could see that the effect of climate change is global. Different people in different parts of the world are having different challenges due to the changing climate. And it's really a call to action that everybody's hand should be on deck to do something, because if we don't do anything, all of us are going down. That is why today I'm here, so that I will learn whatever ways in which I can contribute to solving this problem, to stemming the tide, because we need to do something. A lot of things maybe we are doing, we know that a lot of things, industrialization, and a lot of things that is being done currently is contributing to the problem. So now that we have seen the effects, we have seen that everybody is suffering it in one way or the other from different parts of the world. It's a call for action, especially those of us in healthcare. And here I am today. I want to learn more. Thank you.
Thank you very much indeed, Monica Agu. We're now going to hear and meet, first of all, Maisa Jalad. I've said she's a researcher and citizen science coordinator. Maisa, over to you. Love to hear from you. And again, as we did for the Francophones, I'll try to read your mind about when to go to the next slide. I don't know if you're having problems unmuting your microphone. No. Oh, whoops. I think I'm the one who just muted you again. Please try again. Okay.
Hello,
here we go.
hi. Hi, everybody. Thank you, Rida, so much, and Charlotte, for this amazing event. My name is Maisa Jalad. I'm a researcher and citizen science coordinator, as Rida said. I'm with PROCOL Lebanon. I'm joined with my colleague, Nikolai Minchev, today, who's also a researcher at PROCOL Lebanon and the Institute for Global Prosperity. So thank you so much, Rida, for your assistance as well. So who are we? PROCOL Lebanon is actually acronym for Prosperity Co-Laboratories, and we have laboratories in London, in Kenya, and in Lebanon, where I'm from. And it's a multidisciplinary research center. It's led by the Institute for Global Prosperity, which is an institute based at the University College London in the United Kingdom. So PROCOL Lebanon is in collaboration with several departments at several universities in Lebanon, such as the American University of Beirut, the Lebanese American University, and we're also in collaboration with local initiatives such as the AUB Neighborhood Initiative and the NGO Catalytic Action. We're funded by the UK Economic, Social and Research Council. So we used to be a relief center from 2017 and 2022, and our approach was to develop new approaches to prosperity. So what is prosperity? In the context of mass displacement that Lebanon has seen since 2011. We have several work strands. We work on prosperity in several different groups within relief, and I'm part of a prosperity team to develop prosperity index, a prosperity index for several neighborhoods. So we lead scientific research on well-being and its challenges in several neighborhoods in Lebanon. We adopt a participatory approach. So the data collected is collected by citizen scientists. I'll explain who citizen scientists are in a moment. And we use it to develop urban interventions that address the community's needs and create positive change in the neighborhood. Relief Center became PROCOL Lebanon in 2023, and it's a 5-year project which builds upon the Relief Center's work in different methods and themes. One of them is the Citizen Science Academy, which I'm part of and which you can be part of too, and I'll explain a bit more later. So our values is something so important for us and so important for that our citizen scientists and everyone who works with us shares. So we are locally grounded and inclusive. So we focus on prosperity of locales to the benefit of everybody, all residents, so not just citizens. We are collaborative, so we work with partners to co-design measures, so how to measure different findings and solutions to support existing initiatives. So we don't come parachuted into a certain community. We are citizen-led, so we engage with communities through citizen science and outreach activities. And we are driven by research excellence. As an academic center, our work begins with high quality data, rigorous methodology, and the latest social science thinking. And what is citizen science? So citizen science is a methodology whereby local individuals are trained to become essential researchers in a project. And these local individuals are called citizen scientists. And it all starts with co-designing or creating the questions for the research itself. So we employ a sustained citizen science method where citizen scientists are trained in qualitative and quantitative research methods. They conduct the data collection, they do the analysis if they are interested, and then they propose projects for their communities based on the research that they conducted. And so we noticed that a sustained longer-term commitment using different methods is the best way to ensure a sustained impact in a certain community. So what is the Citizen Science Academy? So since we created this methodology for citizen science, it's actually flexible for different projects all around the world. And so this methodology will be inspired by the Prosperity Index work and the different phases, which I will be explaining in a bit. But it can actually be adapted according to the specific project at hand. So if you are interested, let us know. How does PROCOL Lebanon work with citizen scientists? So it all starts with choosing a site. And I'm giving an example in the city of Mina in Tripoli, which is the second largest city in Lebanon at the north. And as you can see, it's almost an island. It's surrounded with the sea. And so the first thing we do is actually we contact stakeholders and we do a workshop with them. So we like our stakeholders to be as diverse as possible, cross-disciplinary. So we have people from the health sector, but also from education, from NGOs, from the government. And we brainstorm on the issues that matter to us and to the research. And what's very important is that we need to actually transcribe and record the conversations so that we can extract from these conversations important moments or important questions or important indicators that the stakeholders have mentioned in their conversations and answered to our questions. The second thing we do is actually we recruit citizen scientists, and this is an extremely important phase of our work. So we recruit them through the stakeholders that I just mentioned, and through local organizations, and we also do job posts, and we try to recruit a representative group of locals. So it should be as diverse as the community being studied. And so we recruit people from various professional backgrounds, students, employees, workers, and also from socioeconomic backgrounds, from different age groups. Actually, the only criteria is that they need to be motivated, they need to know their area well, and they need to be organized. But essentially everything else we can train in. And speaking of training, so this is what's very important, is to train citizen scientists on how to conduct field work, how to actually do the questionnaire that we're asking them to conduct, how to ask a question, how to be ethical in research, how to be professional while conducting research on the ground and during field work. And what's very important actually is that we co-design the research with them. So we as a team in PROCOL Lebanon, we have a basis of questions that we are interested in knowing about the community. But we can't really ask it like that, just parachuted into a community. So we ask the citizen scientists to workshop these questions with us, to tell us, is this an appropriate question to ask? Is the language appropriate that we're using? How can we ask the question differently? Are there other questions you're interested in asking to the community? So it's really a co-designed approach that is very, very important for us. So the citizen scientists conduct extensive quantitative and qualitative research on prosperity and well-being in communities. They help analyze the data and in writing detailed reports. They propose and produce interventions based on their research. And as part of the team that assists the citizen scientists We assist them with a careful coordination of their fieldwork. We assist them with supervision. We do the sampling strategy and the data management of the actual data being collected, and we also mitigate any challenges that arise on the ground, and you can be sure that there will be challenges. So we need to be really closely with them. And our aim is to collaborate with citizens, support their existing capacities. They're already, they have capacities. So how can we support that? How can we support their expertise and knowledge to co-design this research project that will lead to solutions to actual problems in the community? And we realize that the resulting solutions are inclusive, they're grounded in the local context, and the project actually strengthen relationships between institutions on the ground and these communities. And it closes the gap kind of between what a professional is and what a citizen is. So how does PROCOL Lebanon research health? All of you are health professionals, so this might be very interesting for you. So health and healthy environments is actually a main domain that we research in the several communities within our Prosperity Index. And you notice in these photos how diverse the urban fabric of MENA is, and therefore how diverse the health situation can be in these different places. So you notice on the left, a more urban, social housing with like 3 or 4 stories, and then at the back with the more high rises closer to the sea, so more affluent communities. And then you have in the center heritage, a very historic souk of MENA. And then at the right, there's also actually a bidonville or a slum in MENA of informal settlement. So there are these different conditions in MENA, and it's very important to know them all and to understand them all. And so how can we map all these different all these different conditions? And actually mapping is a very important tool. So as soon as we start working in a community, for example, when studying health, we can start mapping the different dispensaries and health centers. And this is like an initial survey that the PROCOL team conducted at the beginning. But then you realize when you start working with citizen scientists that the survey gets even more detailed. And it starts including pharmacies, dispensaries, hospitals. So you can see here the benefit of citizen science in detailing and really understanding a community. And you notice in the mapping that in the south of MENA, there's absolutely no health facilities. There is a real need. And this is actually the area of the informal settlement. So mapping can be an amazing tool. And another amazing tool is actually brainstorming activities. So this is the result of the Health and Healthy Environments brainstorm, where citizen scientists were just asked to contribute on what they think that is health and healthy environments in MENA. And they talked about planning strategies, physical health, psychological health, the lack of healthcare facilities, and public spaces of healthy environments, and also homes, apartments. How are people living indoors? So one of the examples of people talking about this, and this is why it's so important to transcribe all of these brainstorming sessions. For example, someone said, we have only 1 hospital in MENA, it's still not functioning. It's been built, but it hasn't been put into operation yet. And then someone said, many people don't go to some public gardens because of all the policing and strict regulations. So this policing is necessary in our country to protect public spaces. So there is a real issue of usage of public space, which is not allowing people to have healthy environments in their city. So a lot of problems actually arise in these brainstorming sessions. And so what do we do with these brainstorming sessions? It feeds into our prosperity flower. And so this prosperity flower has several domains. And as you can see, health and healthy environments is one of these domains. And so in health and healthy environments, you have subdomains, which is inside the petal, and then indicators, which are the themes that will help us ask the questions of the questionnaire. And you can see in blue, actually, indicators that changed. based on the citizen scientists and what they told us about MENA that was different than the site that we previously studied in Lebanon. So you can see that they added, for example, access to healthcare, physical and mental, access to open spaces. So that's why it's so important to do these co-design research brainstorming sessions with the citizen scientists, is to really become, understand and create a local questionnaire. The local questionnaire, has questions that we've asked before, but it has new questions as well about health. So I've screenshot here some of the health questions. So for example, during the past 12 months, was there any time when you needed medical care but you didn't get it? Is there a public primary healthcare center in your area? What are the services you most need access to at a primary healthcare center? And then we added some mental health questions about stress and depression. And then, of course, there's a question about the natural environment below. How recently have you visited the natural environment? So creating a very well-studied questionnaire that is actually in Arabic, because this is the official language in Lebanon, and this language. So also the translation of this is an exercise in itself. And another tool is actually mapping. So this map was done based on a survey of infrastructure that the citizen scientists did in all the streets of MENA. And you can see here that there are functional stormwater drains, blocked stormwater drains, no stormwater drains sometimes, and water ponding. And you can see that there is a huge amount of water ponding. So this is the informal settlement actually that we're just talking about. And you can see that most drains are blocked and there is water ponding. And this, for an area that is next to the sea, you can imagine how bad it gets during the winter. So this is all done by citizen scientists. And this is part of the quantitative work. So now we talk about qualitative work through interviews with stakeholders and also through focus group discussions with several members of the community. So we choose random samples of people and we do focus groups with them. And some questions in these focus groups or in these interviews focus actually on health. And so, for example, we interviewed a health facility and we asked them, how is the health facility responding to the community's needs? Which services does the health facility have the most pressing need to expand? So this is a way to have more in-depth answers. And so not just yes or no answers. And then, so from the quantitative work, you get these findings in health, these percentages. And so you can have percentages on the total population, but also on Lebanese or non-Lebanese. So access to social security or other healthcare, for example, 15.2% of the total population of MENA has access. 46.7% are satisfied with the healthcare. Health problems with chronic illness, 2% have serious medical conditions, 73% are really stressed. So you can have these findings because of the quantitative questionnaire that we asked by visiting different apartments of people and asking. So what we can also do based on these findings is separate them by neighborhood. And we noticed here that some neighbors, so this is residents who needed medical care but did not get it in the last 12 months. And you notice that some neighborhoods, some populations have a really dire need. So for example, in Masakin al-Shabiya, 80.8% of non-Lebanese needed medical care in the last year and did not receive it. It's a real, health epidemic. And Tariq al-Mina, it's also very high. For Lebanese people, the biggest percentage is actually in Hayat Tanak, which is the informal settlement that I mentioned. It's the fifth one from below, this one, yeah. So these are some of the quantitative findings in health. We also, as I mentioned, we give the opportunity for citizen scientists to participate in projects that respond to certain needs of the community. And here it was about the need for public space. So in collaboration with NGO Catalytic Action, the MENA citizen scientists co-designed a building and seating area and playing area to the neglected parts of the Corniche seaside walkway. So they created healthy environments for play and relaxation that are close to the underprivileged neighborhoods in MENA. And these places are actually really popular today. So now is our Q&A time. I'm going to ask, actually, if anybody has questions in the Q&A.
Yes, Maisa. So there's actually only one question, and it's from Milkamu Adigo. So she wants to know why this project seems to be limited to some countries. That's question one. Question two is, how can she and others join such an energetic team to contribute her part? And third, she wants to know if there are any job opportunities in citizen science. So very specific questions.
Thank you so much, Melkamu. I really love your enthusiasm and interest. So the reason why it's only in certain companies so far is that the Institute for Global Prosperity has connections in these certain countries. But of course, Yani, we are expanding, and we love to collaborate with people. So I think through Rida and Teach to Reach, this is, we are now connecting to this very large group of amazing professionals, and we look forward to expanding our work with everybody.
Thank you, Maisa. Now, you have a very specific exercise and set of questions. So I'm keeping an eye out if there are other questions from the group. But the exercise is the following. So really reflecting on your experience at the event on Friday, from community to planet, health professionals on the front lines of climate change. We're asking you as participants in this workshop now to give an example, of a connection between health and climate change. And here is where it moves into citizen science, is to really formulate a question. What could you ask a caregiver if you work in immunization? So usually a mom who brings her child for vaccination. What could you ask one of your patients if you do more clinical care, in order to investigate, measure the effect of climate change and health? So that is the question that Maisa has, or the questions that Maisa has submitted to you. Would love to hear first. Let's start. Actually, Irene Tukashaba does not have her microphone connected, unfortunately. So let's see if we'd love to hear from Alice Niaboke. Please raise your hand if you'd like to go first. Otherwise, we from Angela Atayo as well. Anuolu Wapo Popula, I'm asking you to give this question some consideration, and then over to Charlotte to identify some more folks. While you think about these questions, and I'm going to, Maisa actually mentioned it, the upcoming Teach to Reach number 9. So for the 9th time, thousands of health professionals will be coming together. The date, okay, this is the French one. I'll go to the English. The date is on the 13th of October. And it's a unique opportunity to meet, network, and learn with fellow immunization, other health professionals from all over the world. Last Teach to Reach 8 was on 16th of June, connected almost 17,000 people. So if you're new to the Geneva Learning Foundation, if you're new to Teach to Reach, make sure you request your invitation. It really is as simple as putting in your name and email, and then yes, you will receive a flood of emails, but each of them has a specific purpose, and you don't want to miss any of them. Charlotte, who seems to be ready to take on Maisa Jalad's questions about citizen science, and what question, as a health professional, it looks like Anuolu Wapo Popula would ask the caregivers or the patients that she sees. Anuolu Wapo, a warm welcome to you. Tell us who you are, what you do, and then tell us what you would ask, what questions you could ask the community.
Hello, good afternoon.
Yes, good afternoon. Yes, we can, but it's not very loud. Can you speak closer and louder with your microphone, please?
Okay, sorry. I'm on transit. Please, my name is Popola Anodua for Taiwo. I work as an environmental health officer in Federal Medical Center, the state of presently. I'm in the UK. I will ask that, we are in the world of sustainability, and what are we doing as health caregiver to prevent all these prevent diseases? We know the world is going down. There's many diseases that we cannot mention. But what are we doing to prevent all these diseases? A good environment to prevent so many diseases. As healthcare worker, what's our input in preventing diseases?
Okay. Anuolu Wapo, so if I understood correctly, it's about what input you have as health professionals. That's not the question being asked here. It's a super interesting question. But what Maisa has asked you is, if you next time you're with a caregiver or a patient, what could you ask them to get a better sense whether your observations on health and climate change hold up to scrutiny? All right, we'll come back to him. Let's go to Susanna and Koma Asari, and let's go to Melkamu Adigo as well as Simiat Adeogun. We'll just keep, yes, Melkamu Adigo, your microphone is unmuted. Please tell us who you are, what you do, where you work, and then answer the two questions that are on your screen, please.
Right, are you hearing me?
Yes, loud and clear. Tell us where you're connecting from and what you do.
Thank you. My name is Melkam Adigo from Ethiopia, Addis Ababa. I am working as vaccine safety and adverse event following immunization technical advisor from Ethiopian Food and Drug Authority. So I want to mention some pointers regarding your questions. What questions can we ask our community to measure the effect of climate change? You said. So I can ask if I am a citizen or a citizen scientist. I can ask some such as their life experiences, their living conditions. If there is climate change or any activity related to their health, I can also ask them any disease outbreak is there any epidemic or disease outbreak related to such as I may ask such as skin disease or as any water or airborne disease and such questions. So their living condition may be changed from time to time based on the climate or the weather condition. So even I can ask them how is the productivity or in regard to agriculture. In one way or another way, our nutrition or our food is related to the food we consume or we get in largest amount or in different variety of food items is related to our health. So I can ask such questions. For the time being, this is enough. Thank you.
Thank you, Melkamu Adigo from Ethiopia. Let's go now to Simiat Adeogun. Simiat, please introduce yourself and then tell us what question would you ask the community you work for, that you serve as a health professional, to measure, to better understand the effect of that climate change is having on health.
Okay, good afternoon, everyone. Am I audible?
Yes, loud and clear.
Okay, so my name is Simiat Adibu. I'm a principal veterinary officer with Osun State Ministry of Agriculture and Food Security, and I'm also a field epidemiologist. So I work closely with the Ministry of Health. So as a health professional, when I'm in the community, I want to test their knowledge of climate change and health as well. So I want to find out from them if they actually have any particular knowledge about what we mean by climate change. What are the things that they think can cause climate change? Okay, so in your area, what area do you stay? Do you have rainfall? Have you observed that, okay, maybe in a particular season of the year, do you have increase in any particular ailments? Do your children face anything? Then are there, I also want to talk about their attitude and perception too. Do they actually carry out any particular things? Do they have things that they do to prevent themselves from all these probably vector-borne illnesses? Do they use long-lasting insecticide-treated nets? Do they sleep under it? Do they engage in hygiene conditions? Do they sleep under hygiene conditions? Do they do proper hand washing and things like that? So essentially, when I'm talking to the community, I want to communicate the risk of climate change and health to them. As well, I want to test their knowledge. I want to know about their attitude and their perception on the subjects on discourse.
Thank you. Thank you, Simiat Adeogun. Let's go now to Irene Tukashaba. Irene Tukashaba does not work in immunization, I believe, or did in the past, is a community health worker, very, very dedicated one, and one that is very involved in the rights, the advocacy for community health workers. Irene, we'd love to hear from you. You were at the event last Friday. Next time you talk to the community, what questions could you ask the people that you work with, that you serve, to measure the effect of climate change on health?
Yes, good afternoon, members.
Yes.
My name is Irene Tukashaba, a community health worker from Uganda. True, I was at the event last Friday. So if I went to the community, this is the kind of question I would ask to the community members. I would ask them for the longevity of the pandemic, or of the changes in climate or weather, so that we could see what kind of period people are unsafe and
Irene, I think we lost you. I can no longer hear you. Please go ahead. All right, looks like we've lost Irene. That will happen. We'll bring her back. In the meantime, Pamela Njeru and Giftie Akoswazi Adzigbe. Irene, I suggest you finish your thought in the chat. Pamela Njeru, could you introduce yourself and tell us what question you would ask the community to get a sense, to get a feel, to better understand the effect of climate change on health? But first, tell us who you are and what you do.
Okay. Good afternoon, everyone. We have different times at this hour. Pamela, and also in the community.
Pamela, I'm very sorry, you're breaking up for me. We'll give it a couple of. Please keep talking. If you're still breaking up, I suggest you type your comment in the chat, and we'll read it out for you. Go ahead, Pamela. We'll give it one more try. If there's anything you can do to improve your connectivity, that would be much appreciated.
Okay, let me try. Can you hear me?
No, I'm afraid it's not going to work. But Pamela, please do contribute. You can just type quick notes into the chat. Giftie Akosua Zikbe, please go ahead. Introduce yourself. I hear a lot of background noise, so I hope you haven't accidentally turned on your microphone. Giftie, would love to hear from you. All right. Giftie is not actually maybe busy with something else. I see many actually a few hands raised. Let's try. Let's go to Joseph and Gugi, longtime scholar and also a leader in the movement for immunization agenda 2030. Joseph, you're always good to hear from you and your wisdom. All right,
Hello,
Gifty.
good afternoon, everyone.
Okay, let's go to Gifty, and Joseph, then we'll come to you. Gifty, what?
Hello, good afternoon, everyone.
Please remind us who you are, what you do, and then tell us. Seems to be fidgeting with a microphone, so if there's a way for you to stabilize that, and then tell us who you are, what you do. Remind us, and then tell us what question you would ask the caregivers that you work with as an immunization professional that could help you better understand what effect climate change is having on the health of the population you serve.
Okay, thank you. Good afternoon, everyone. Please, can you hear me?
Yes, loud and clear.
Please, can you hear me? All right, okay. So, good afternoon, everyone. My name is Giftie Jigbe. I'm a community health nurse. I work in the Goma West district of Ghana, and I work more with a deaf community. Yes. So, because I normally come into contact with children and also the whole family, and I also believe that I am the first contact, because community health nurses, public health nurses, we are the first to meet people in their homes even before they come to the hospital. So with climate change, with what I know that it has so many effects on the family or an individual, when there are too much rainfall, we know that there could be flood and people cannot even come to their vaccination post. The health workers. And the same way, the caregivers can also not bring their children to the place for vaccination. And that can also lead to people being missed out, or children being missed out for their vaccinations. And also, I know when there is dry season too, that can also pose another challenge. So with this in mind, when I come into contact with these people or my clients or my people in the facility or even in their homes, first of all, I need to know, I'll ask them, what is your job? What do you do for a living? Yes, I'll ask, because some could be farmers and some could be fishermen. With this, when I have this in mind, it will give me a clear idea on what actually they do for a living and what they actually do in the community to support their family. Then I also ask, when do you experience climate change? When do you experience your rainfall, and when do you experience the dry season? These two questions are very important, because every area or every region, and sometimes every country, you have your pattern rainfall. Okay, so when there is rainfall, there could be malaria, there could be cholera, there could be other conditions, and then when there is into, there could be malnutrition, because there will not be enough food for them. So this was also what you do, or when you experience this climate change. Then my third question will be, what health conditions? Please, can you hear me? Can I continue?
Yes, I believe Joseph is having a separate conversation. Please conclude, Gifty, so we can hear other contributions,
Okay.
and then go to my
All right. Okay. So my third question will be, what health conditions do you experience in the family? Yes, I'll ask this question because individually, like I said earlier on, I already asked what their job is, whether they are fishermen or farmers. Then I also ask when they experience climate change, that is the rainfall in the dry season. So the third question is, what health conditions do you experience in your family, among the children, among women in their reproductive age, and then the aged? Yes. So when there is rainfall, I know with the aged, definitely they are going to experience a different thing. And then when it comes to the children, when there is rainfall, what happens? So if they're able to tell me, they themselves should be able to tell me what they experience, because I'm not there with them, but I want to understand them. I need to get that feedback from them. So what conditions do you normally experience during the rainfall and then the dry season, that is the climate change? Then the last one is, what do you do to protect yourself and the family from this climate change? That is when there is rainfall. What happens, and how do you protect yourself during those times? I know there'll be malaria, there could be other conditions. And then when there is dry season, that is when there's no food. Because they're not going to have enough products from the farm. What do you do to help support the family? So these are my questions that I'll ask.
Great, thank you so much, Gifty. There was this kind of scratching noise on your microphone that I hope may have prevented some people from fully understanding what you said. What I take away is it's obvious the in-depth knowledge why we speak of health workers as trusted advisors to communities. And I heard that in all of the questions and the considerations that you took into account. Now, we're going to go to social media. I know Joseph Ngugi has been waiting to speak, and there's also Alice Niaboke, who has her microphone unmuted. The reason we're gonna go to social media for a second because there are people sharing some really great questions as well. I also want to acknowledge the questions in the chat. So let's see if we can do a quick review. Ruth Olote says, so has a question for Maisa about the sort of prerequisites for citizen science, in particular with cartography or geographic information systems. Now, Anthony has a question that the community can be asked: can people in the community access health services in case of heavy rain? So obviously more rain or heavy rain could be related to climate change, could be just an unusually rainy season, but that's Anthony's question. Ruth says we can ask of where they live, what they do, and how things like floods or droughts affect them. Mariama Idris says, I will ask community to watch out for measles during heat. So that's not asking a question of the community, but again, as a health worker, Mariama sharing advice. Oye Laja Olaide says, all right, she was just introducing herself as a medical laboratory scientist. Fanny Ogwo, I will ask the community dwellers if they have noticed any change in climate, and if yes, how? What are they doing about it, and who are the people tackling the challenge? Ruth Olote follows up with, I can ask, are there certain times of the year that they need to do something to protect their health because they experience extreme weather conditions? Anthony also has a follow-up question. What is the effect of climate change in the community where you live? But others asked, does the community understand what is climate change, and are they able to observe these effects? Jeffrey Mutali, I would ask the community where I work to tell which is the best season that's comfortable for them, rainy or dry, and its advantage and disadvantages in terms of health of climate. Oye Laja Olaide, I will ask them if they have observed that a particular illness occurs in a certain period of the year. I will also find out from them if the illness occurs in a particular age group. That's just a sample from what we're receiving via social media. I want to, let's see, how are we doing on time? Yeah, we'll hear from Joseph and then Alice, and then we fully expect Maisa Jalad to have fully processed all these questions and to give us a synthetic commentary and insights and her reflections. Joseph, over to you. Do remind us who you are, what you do, and tell us what questions you would be asking the community.
Good evening, good morning. I'm Joseph Goge, Senior Community Health Officer and a public specialist from Murang'a County in Kenya, and a member of Jennifer Running Foundation. The question I might ask the person is where the source of water, how they get their water. And if you know how they get their water, you can know whether they are floods or they get the rainwater or the stream or from the dam. That way you can know the effect of climate change. And also the food they grow and the food they eat. Because in an area there's a food which is supposed to be growing there, and if it is not there, you know that there's a climate change. And the food they eat, you will know the food which is imported or food which is grown around. So also that one will give the effect of the climate change or a guideline. Thank you.
Thank you, Joseph. All right, let's hear from one final contribution from Alice Niaboke. Alice, I hope you're able to unmute so we can hear your voice. And looking also if Irene, okay, yes, we'll come back. I'm glad Irene was able to complete her thought, I hope, in the chat. Alice, a warm welcome to you. Tell us who you are, what you do, and then tell us what questions would you ask the community to gain insights into what is happening with climate and health.
Yes, I'm Alice Nyaboke from Kenya. I'm a community health worker. So when I meet my community members, I would like to ask them, are they aware that most allergies with unknown allergens are due to climate change, and the respiratory diseases, the common respiratory diseases are also due to climate change? Are they also aware clean environment or the alternative, the polluted environment can lead to these diseases? Do they know that the polluted environment can lead to climate change? It's a contributing factor to the climate change. Then we live in town where the space is limited, so there's no room for planting trees. the small spaces, of course, we can get the small spaces we can plant trees. Can they come up with better ways of planting the trees and ensuring that it grows? Because the small spaces are most accessible by vehicles and the playgrounds. So if they can come up with a way of protecting the young tree to grow to maturity. Thank you.
Thank you very much indeed, Alice. So just before we go back to Maisa, there are so many contributions, testing knowledge of known effects of climate on health, the pollution and the link to disease, but also how is the environment in your community, family situation more generally, access to vaccination, health conditions in the family, agriculture, testing knowledge about not only climate change, but also attitudes and behaviors, how to communicate risk. Are there practical questions? Are there drainages? What's the waste system look like? Where do people get their water? Many questions. Maisa Jalad, you are, of course, a seasoned veteran of citizen science. What do you take away? How do you make sense of a discussion like this where practitioners are sharing many different possibilities? Yes, all kinds of questions that would be asked. Is what we're doing right now, is this part of citizen science? And what are your reflections on what you've heard so far?
Definitely, Rida. I think this is extremely rich conversation and is really ground for an incredible research project on health and climate change. What I take from this entire conversation is that it seems that health and climate change are connected to the very essence of living in a space. So like it feels that the community of health practitioners is interested in how people are living, what are they doing for their livelihoods. So it seems that like an entire index can better tell the whole picture, like the broader picture we have, the more answers to our questions we will have. So for example, I love how Melkamu said that he's interested in like the living conditions, the life expenses, how detailed he was talking about different disease outbreaks when it comes to skin that's affected by water or airborne problems. So there are some questions asked that can actually be measured quantitatively. I also think about Giftie's questions, like the flood that's preventing people to come to vaccination. So access. So like I can very easily imagine a question being, have weather conditions prevented you from accessing health services? And you can get a yes or no answer that is really clearly connecting the effects of climate on health access. So I think this can be a very powerful tool to prove this correlation, that weather affects access to health. Of course, connecting it to the entire family. And actually, this is why the surveys that we conduct are household surveys. So you don't just ask a question to an individual, but you ask a question to an individual about also describing the entire household, and whether different members of different age groups in the household are experiencing health issues differently. When it comes to the source of water, like I can imagine a mapping exercise at the very beginning with the citizen scientists. And of course, when it comes to mapping, just keeping in mind the question from the Q&A, no, not every citizen scientist knows how to use a map, but that's why we teach, that's why the training is so important. And that's why we teach how to use a map. And so I can imagine an exercise with the citizen scientists of what are the sources of water in this community before going to the actual community and asking this question. This way we can actually cater the questionnaire to the existence of these different sources of water in the community. So that's why designing with citizen scientists is so important, designing the actual research. When it comes to the awareness of climate change, I think this is more of a qualitative question that we can ask in a brainstorm or a focus group. You know, do people know what climate change is? You know, like, let's start from the very beginning. What do people know about climate change? Do they see its effects? So I think this is extremely rich, and I'm really happy. Is there anything else, Rida, that you would like to take out from this Q&A? Have I missed anybody's important question?
No, I was going to suggest that we, as we have 3 minutes remaining, I've lowered all the hands and wanted to suggest if there's someone who has been moved, really moved emotionally by this discussion, by following up on the Friday event, and would like to share their thoughts and what they are feeling, as well as thinking, please do raise your hand then. And then we will close this event and announce some of the follow-up again to this, as we said on Friday. Again, we encourage you to go check out the editorial from Dr. Julie Jacobson and colleagues. She is the former president of the American Society of Tropical Medicine and Hygiene. Some thoughts about how we are learning with you and why you matter. The 2nd of August, well, we had announced this on Friday, so we've now completed this workshop. We hope that we are leaving you thirsting for more, and that is because on the 13th of October at Teach to Reach 9, we'll be having the second session from Community to Planet. This will be part of the new Manifesto for Global Health. Hundreds of you have contributed. I believe it's now in the thousands, so we'll be sharing. We shared open source version 1 in June. We'll be sharing version 2.0 at Teach to Reach 9. And then we've just submitted our proposal for a special event for COP28. So this is a conference of parties and really a call to action from health workers to health workers, but also to all the other stakeholders concerned about climate change. So, of course, don't forget to request your invitation for Teach to Reach. I do see Mohamed Utaru as hoping someone would want to share some parting thoughts before we close. Mohamed Utaru, please go ahead. I hope you are able to unmute. And so you will be our final speaker for today. Mohamed, a warm welcome to you. Please tell us who you are, what you do, and what is your parting thought at the tail end of this session.
Thank you very much, Reda, and the presenter. Sorry, I joined in late because we are presently having an FIPV campaign in Nigeria. So it has been very intense implementation. So by and large, I have actually experienced such climatic change questions. And of course, I've interacted with a number of communities in my area of work. I am Mohamed Utaru, a public health professional with major and focus on immunization, nutrition, disease surveillance, and data management. So I would ask the community inhabitants, what do they think climatic change is, and how have it affected their visit to health facility to access health services? Secondly, I'll ask the caregivers again, what and how long does such change take to allow them access health facility, and of course, what do they go through in trying to access health facility within the period of the changes in climate? 3, I would also ask what time do they have to access, and of course, do they get the required session they deserve or they desire at when they finally access health services? And of course, what nutritional component do they meet and do they lack within that period, both across the family members, including the children, and of course other family members, and of course the community at large. Thank you, and over.
Thank you very much, Mohamed Utaru. Wonderful contributions. Great to see participants sharing contact information. We'll be following up so you can all connect to each other. Remember, that is what Teach to Reach is all about, making those connections and building that your own network for your professional needs, but also for needs for the concern that you shared about climate and health. I'm aware we have a number of questions in the Q&A we have not gotten to. We'll share them with the relief team, with Maïssa Jalad and her colleagues, so we can follow up properly on those. Once again, thank you. We look forward to the next dates on our agenda. Teach to Reach on the 13th of October, where we'll be presenting your Manifesto for Global Health. Version 2 has received hundreds of contributions, and then looking forward to the 1st of December special event, a call to action, buy-in for health workers, but addressed to everyone who works on climate and health. Wishing you well, and look forward to being in touch. Bye-bye. If you have a message you want to get out, we're sharing with the live stream your messages in the chat. Now, thank you. We really are grateful and wish to honor and continue to serve this amazing community of health professionals. Thank you. And thank you to Maïssa Jalad and her colleagues indeed. Yeah. Thank you, Oyelaja Olaide, for your contributions as well. Mary Goretti Otieno, Abrahim Mohamed, Diodone Bu, Melkamu Adigo, Cecilia Bandera. I hope you know that you are in one of the featured stories for this climate change and health event, dear Cecilia. And we hope your grandson as well. Indeed, the recorded webinar is already available on our YouTube channel. Before you go, I'm going to ask you to do one thing very important. If you can, if you have time, let me see if I can find the links. Yes, is really to follow us across our social media. So just click on one or more of the links that I've just shared and make sure you follow and turn on notifications so you don't miss anything that is coming your way. We'll now do a quick rewind of the comments that we received throughout this session, and we'll switch the musical geography a little bit. Of course, for those of you who need to get back to work, please do so, if that's what if duty calls. We know many of you have taken time out from your daily work in order to be here.